If you appear to have symptoms of inflammatory breast cancer, your doctor will likely order a diagnostic mammogram along with other imaging tests to gather more data. The doctor may then request a biopsy of the breast tissue to confirm the diagnosis. In the case of inflammatory breast cancer, the doctor will also be looking at the regions surrounding the breast to determine how far the cancer has spread to the lymph nodes and other tissues. Once all the data has been carefully gathered, the doctor can then begin determining the best treatment plan for the specific patient.
The presentation is what makes inflammatory breast cancer. And the two things that are required from the clinical aspect are swelling in the breast, which gives the skin an orange peel appearance, which is called peau d'orange, and redness in the breast, or erythema.
Inflammatory breast cancer can grow very quickly, often in as little as weeks or months. It's important to note that this form of breast cancer does not have a distinctive lump and may not appear on a mammogram.
Inflammatory cancers, when they're diagnosed, because they often present like an infection, cellulitis, or mastitis, diagnosis can be somewhat delayed, and patients will present having gone through multiple rounds of antibiotics trying to get rid of what they feel is an infection before they ever get to the point of a breast image, such as a mammogram or an MRI, or a breast biopsy to confirm the diagnosis. Majority of them, greater than 55%, are metastatic at the time of diagnosis to the local lymph nodes, and about 1/3 are metastatic to distant sites at diagnosis. So these patients, they start out as what we call stage 3s, which is more a farther staged breast cancer, and they start out with a poorer survival. Although it's a scary diagnosis, it is a rare diagnosis, and it's about awareness. As long as patients are being seen by doctors who specialize in breast care and are aware of the diagnosis, it can be caught. Survival, although not guaranteed, is much improved with newer techniques than it was many years ago. And given the opportunity, we really do feel these patients have the possibility of doing just as well as those others diagnosed with breast cancer.